Hi, everyone. This is Dr. Jessica Rial with Southern Pelvic Health, and I'm very excited for our provider spotlight this month to talk with Dr. Ali from Explore Health and Wellness.
Hi.
Thank you for being here today.
No, thank you for having me. I'm really excited to talk with everybody.
So I have known Dr. Ali now for it was honestly shortly after Southern Pelvic Health opened in I believe it was probably late 2019 or so when we first met. And she is an amazing chiropractor in the East Cobb area. And we started collaborating and working together, and I had referred some patients over and she's referred patients over here, and we just have found that working from a physical therapy standpoint with chiropractic care has been just a very beautiful model for helping many patients in their healing journeys. So what I wanted to do is bring Dr. Ali on today to talk a little bit about her and her practice and how chiropractors often work with, well, some chiropractors work
Yeah,
with people who have pelvic health problems. So thank you again for being here. And if we can just start, I would love if you could just share a little bit about you and about your practice.
awesome. Well, like Dr. Jess said, I'm Dr. Ali Crich. I work at Explore Health and Wellness. We're located in the Park Air Complex where the big Kroger is. And I have been in the Atlanta area now for 8 years, which is crazy. I'm actually originally from Canada. This is a whole different world for me down here. Um, We specialize in our office in pediatrics and pregnancy. What I do, our whole office is very family centered. We have lots of families in care. The youngest we have ever seen in our office is 2 days old. And the oldest, we actually currently have a 93-year-old in our office. So truly a whole span. And we see, everything from that typical low back pain that most people think to go to a chiropractor for, to ear infections in little ones, colic, allergies, constipation. That's a big one. I always have a change of clothes in my office because you never know what's going to happen. So yeah, we just love it. And we love to make a family friendly feel similar to Southern Pelvic Health.
I love that. Now, some people are very familiar with working with chiropractors. We have patients who come in and they have a chiropractor that they see really regularly. And then other people, have never had an experience working with a chiropractor and may not really understand what chiropractors do and how, someone like you might be of benefit to them. So I was hoping you could talk just a little bit about chiropractic care and what you do for your patients.
Awesome. Well, that is a typical question we get. A lot of people think that it's this big, adjustment, and they kind of get scared, to be honest. Not all people, but some people do have that reservation. So, the best way that I can explain it, and truly what we do, is we're really doctors of the nervous system. That's what we focus on. We focus on making sure that that brain is connected down through all of your nerves in the body, and that there's no interference. And what I mean by that is, our spinal cord is housed in all of our vertebrae. And over time, well, not even over time, but just our typical daily things that we do, twisting, turning, picking up our little ones, playing in our good rec sports leagues, those vertebrae can kind of shift out of alignment and they can cause issues. And when our body is out of alignment, our brain isn't sending those messages 100% through our body. So kind of think of it like talking on a cell phone with static. You're like, I think I got the message. I think they said turn right, but it could have been turn left. So that's kind of how, when there is something going on in our body, what's happening. And when we work through adjustments to get our body aligned, it takes pressure off of all those nerves. It allows our muscles to pull in the actual, vector that they're supposed to. And it helps that we're walking around, not crooked, not twisted. And that's kind of our job, is to facilitate that happening. Like I said, most people think of it as a big, kind of cracking noise. Now, there are adjustments and techniques that can cause that. Some people really like that relief, as they say it. They really want that twisting. But honestly, 80% of the time it's not like that. It's very gentle, it's very specific. We're trained, we go through 8 years of training to be able to do this job. A lot of people don't know that either. Some people just think we come right out of high school, and we're like, no, we have 2 degrees at least. And so, we're analyzing your spine. In our office, we're doing a lot of objective measures. I'm a very visual person, so I love to be able to see problem areas, as we like to call them. So we have thermography in our office. We do a posture analysis so you can really see it. And throughout care, we do those objective measures, every 12 visits or so, depending on your treatment plan, so you can see how you're getting better. So that's how we really like to do chiropractic in our office.
I love it. And,
Yeah.
like you were saying, I think, I see different things with people, some people thinking about getting a big manipulation, they're like, yes, they like want that and want, a more, I like to call them assertive techniques.
Yeah.
But then I do think some people get nervous and I was hoping you could talk just a little bit more about some of the more gentle approaches and stuff that you guys use, just for people who are nervous and and some bodies I know can be sensitive and may respond with more assertive techniques by guarding and gripping and bracing and stuff. So can you talk a little bit about some of the gentle approaches you all use?
Yes, of course. So our tables in our office, they actually have a bunch of kind of breaks in them when you look at them, and those allow us to have something called drop technique. And what that does is kind of the table pops up underneath you, and then we're placing our hands where they need to be, and then just do a light drop, and the table drops down as well. That's one of the techniques that allows us to use gravity, and that way we don't have to do that big sort of adjustment and with that cracking. So you barely hear anything with that. And it's still very efficient. Some people kind of say, well, if it's gentler or if I don't hear it, did it really happen? We get that quite frequently too. And that's a double-edged sword. Of course it still happened. There's so many different ways about it. It's just like any profession. There's 52 different ways to get from point A to point B. And it's just whatever way is best for your body and also what you're comfortable with. Because like Dr. Jess was just saying, if you're guarding or you're, kind of protecting yourself or nervous about it, we can feel it. And then your body isn't receptive to that adjustment. So like I was saying, there's a drop technique. We also use something called an activator technique. I wish I had my activator. I could show you what it looks like, but it's just about 10 inches long and it kind of looks like a clicker. A lot of our little ones think that it's a clicker. And we can use that right on specific spots and allow us to get specific angles. It's actually a very common one that I use on littles when I adjust them. Once I can get them comfortable with thinking it's not a needle, because we definitely don't do that in our office. So that's one of our other techniques. We also use a lot of cranial techniques with anybody with headaches, post-concussion. Our littles, I use a lot of it with plagiocephaly when you have a flat head or a flat spot. If a little one has torticollis and they've been laying on their back a lot, their parents, want to avoid that helmet and they come in for that. Those are our kind of gentler techniques. We also have other modalities in the office. We do use cupping therapy sometimes, and we also use a muscle tool. It's called a factor tool, kind of similar to something called Graston that people may have heard of. It's like a long metal tool. It's very gentle. And it does not cause bruising, even though everyone thinks it might. They get a little scared with that one too, but we do it very gentle, very specific. And that kind of helps us realign those muscle fibers and really help you get the best that you can. A big thing in our office is everybody's different. So you're going to see some techniques used on a patient maybe across the hall from you or different ones on you, and just know our hearts are always in the right spot. We're trying to get you where you need to be. And we're also trying to meet you at your comfort level too.
Mm-hmm. Awesome. Awesome. Now let's talk specifically about the pelvic health population, just because,
Yeah.
you guys, you all treat a lot of different things, but we here
Yeah.
specialize in pelvic health. And so all of our patients coming in are dealing with some type of pelvic health challenge, or might be, prenatal, postpartum, prep for birth, that type of thing. But all ages, from kids with constipation to, older adults in their 90s. And so we do treat a spectrum with that. But can you talk a little bit about how chiropractic care can be helpful for people who are dealing with pelvic health challenges?
Yes, that's a great question. And like we said earlier, we send a lot of patients to you, you send some to us because we both see the benefit of it. And how chiropractic can work with pelvic health physical therapy is that all of those organs, they're sitting in that bony pelvis. And when our pelvis is misaligned, it can put a lot of pressure on those organs. It can put a lot of pressure on those muscles, and it can put a lot of pressure on that pelvic floor, especially as the baby is growing for our prenatal population. Our pelvis is constantly shifting to carry the weight of that. And when the baby gets big enough, there's lots of pressure down there, and our pelvis is starting to tip forward to kind of get that typical pregnant posture that we see. This Once we're aligned and we make more space for that baby, it can alleviate the pressure off the floor and allow those muscles to actually be the length that they're supposed to, and they're not just trying to hold on for dear life the whole time. Another big thing that we see with postpartum, once that baby is out, our pelvis just goes, whoa, I just adjusted for the past 9 months, almost 10 months to this growing baby, and we just pushed it out. And then now it's almost all loose, just as some people do feel with their pelvic floor. So to allow the muscle to sit properly, we want the sacrum and the coccyx area, the lower back, kind of in between those glute muscles, to not be pulled forward, not be twisted. A lot of times that does happen in birth. I mean, think of how long a woman is pushing and what position they're pushing in. So alleviating that, making sure that's aligned, making sure our hips are aligned again, just allows all the work that you do at your office to really settle in and hold. That's a big thing too. We want it to hold. We want you to not have to see us constantly. We want your body to eventually, as much as we love seeing you all, we want your body to actually hold the adjustment and to hold the work that Dr. Jess and her team are doing as well. And they're just, they're synonymous with each other. The muscles are pulling on the pelvis. If the pelvis misaligned, they're going to pull on the muscle. It goes back and forth. Now, if you're not prenatal or postpartum and you have a general pelvic concern, there's still things that we can do. Typically, over time, our low back takes a lot of pressure, especially in females. Our low back is taking pressure. Our pelvis, they're a little bit wider than the male pelvis in general. So we just work through a bunch of techniques to make sure that the alignment happens. But also, we've had quite a few ladies who have come in who have had a hysterectomy, and they're wondering how we can help with that. Now, the uterus does attach to the sacrum via a ligament. So when the uterus is removed that way, our whole low back is thrown off from an organ being taken out of our body. And no wonder we're having pain from that. Our low back will compensate, our glutes will turn off or they'll overfire. And then our pelvic floor, of course, is going to be impacted by that. So we just want to make sure that your body is ready for what it can do. It's aligned, as you've heard me say many times. It's also allowing the muscles to function properly, and then allow what Dr. Jess and her team is truly, their work needs to be able to hold to.
Mm-hmm. And one of that's so helpful. And, one of the other things that I've seen where I've referred some patients to too is, I think sometimes when we think about pelvic health problems, we can focus a lot on the pelvis, of course, right? But we've had some patients that we've worked together with where, their pelvic floor, I'll always call it like the bystander, where it's not, that's where they're feeling the problem, but the problem could be coming from the fact that they carry so much tension in their thoracic spine and in their neck, and it can impact the pressure system down into the pelvis. Then the pelvic floor is impacted. And so, I think that area is also another area where I think you all can often be so helpful, in helping people restore mobility in their thoracic spine and their cervical spine, and get into a space where their muscles are able to let go and better modulate all of that pressure.
100%. We see that a lot, as your profession and my profession, we see it, everything's connected. So like you said, something could be happening in one area, but it could even be, the bottom of their foot is tight, causing pulling on their knee, causing pulling on their hip to misalign their pelvis, and when we can see the body overall, that's the best way to find true health and wellness and to feel better. Is you can hammer in one spot all day long, but it keeps coming back, and it's because it's linked to something else. And like you said, mobility is huge. Making sure our whole body is functioning properly. That's how we see it in our office. And that's why you can come for low back. And, we've had people say, I just want you to work on my low back. Okay, well, that is connected to a whole bunch of things that can be causing your low back pain. So, that's part of the education in our job, and educating our patients is understanding why everything is connected, because we don't learn that. You know, the average person, and I don't blame them, you don't actually learn that in health, in our health
Mhm.
classes. So yeah, it's our job through, you know, what I do and what you do to teach everybody.
Yeah, and people are often really surprised. I remember back probably about 8 years ago or so, I was working with a 18-year-old who had really significant pelvic pain. So she was having pelvic pain. She had constipation also, and started having pain with exams, with using tampons, stuff like that. And it
Yeah.
was interesting because I came in and evaluated her and very quickly recognized that she had a knee problem. And it
Wow.
was on her left side, and a lot of her pelvic pain was on her right. And
Mm-hmm.
and once we started addressing her knee, her pelvic floor was able to let go. And it was funny because I talked to a provider who was working with her shortly after, a physician, and they said, they were asking about how she was doing. I was like, oh, she's doing really great. And, we ended up finding out the problem was her knee. And she jokingly said to me, like, oh, she's like, Jessica, what was I thinking? I should have looked at her knee when she was complaining to me about constipation and stuff. And I was like, mean, you kind of have
Yeah,
to, because
yeah, you
because
do.
people are like, I tell people, like, you're not a pelvis, you're a person who has a pelvis who also
Mhm.
has everything else too.
Yeah,
So I'm sure you've
yeah,
seen similar things with your patients as well.
yeah, very similar. You know, you never, they come in, like I said, thinking it's one thing, and we just, through our objective measures and showing them through our exam how everything's connected, it just blows them out of the water. And they're like, I didn't think that, you know, falling off that horse 10 years ago caused the shift in my pelvis, and it went all the way up through, and now I have neck pain and have chronic headaches. Like, they had no idea. And so, it's just one example, but we just see
Yeah.
it consistently, like you guys do. And I
Yeah.
actually love those light bulb moments when you see that they get it,
Mhm.
and you're like, ah, yes. And now they know what to look for, and they can also pass it on too to other of their friends and families when they hear things. And that's kind of a big, we want it to spread as far as we can, because like I said, people think chiropractic is just that low back pain. And once they find out the doors that can be opened through, pediatric, pregnancy, postpartum, and just women's health in general, they're like, I wish I had been here 10 years ago. I wish that I could have done this concurrently with everything else I'm doing. And they really, really see results quickly. So that makes me
Yeah,
happy.
I love it.
Yeah.
So
Yeah.
tell me, you work with a lot of different populations. What's your favorite population to work with? Like, what are you the most passionate about?
That's a great question. I feel like I have quite a few passions, but I just had a baby about 6 months, 7 months ago now. So my kind of big current thing right now is postpartum. I love that population because I really feel like the support for postpartum in this country is absolutely terrible.
Yes.
Growing up in Canada, the maternity leave there is a minimum of a year, and you can actually push it to 18 months.
Mhm.
There's so much more care for the mom. And now, having gone through a birth and I'm on the other side trying to rehab from it, I realized, like, I have to put my team together. I have to find this and this and this. And if I did not do that, I would still be suffering with that post traumatic stress that I had from the birth, the anxiety, the postpartum anxiety, my physical body. I mean, leakage is a real thing. After you have a baby, you're like, wow, I went from CrossFitting 5 times a week to I try to do a jumping jack and I'm like, I got to run to the bathroom. So that population has definitely just kind of started to feel heavy on my heart. I definitely have started to make a little soft spot for that. And empowering women in that time of their life, because they do feel isolated. You ask a lot of women, when did you feel at your lowest? And 8 times out of 10, I've gotten the answer. It was right after I had the baby. I just didn't know what was going on. So that population definitely takes a toll on my heart now, and I definitely want to help them. Pediatrics has always played a big role. My husband and I have been lucky enough to go down and do a lot of mission work throughout Central America.
I love it.
Specifically, yeah, El Salvador. We've been down there, and I got to go into kind of an orphanage area, and just seeing the kids down there, and what they're dealing with and how happy they still are. that population and how what we do helps them. I actually had a family when I was down there. We kind of rotated spots throughout El Salvador. One spot we'd be here one day and then we'd go, 2 hours away or 1 hour away, just all throughout the country to spread it as far as we could. And I had a little one and she was about 5 months at the time and she had been dealing with torticollis. So her neck was kind of stuck in this position, chronic ear infections from that, flat head, all of that. And I adjusted her. It was day 2 of our trip, and they found us again on day 4. So 48 hours later, and they found. I mean, they had to take 4 different cars. They said they found us, and they brought her back. And they specifically waited on for me and came up to my table, and I just started crying. I mean, I couldn't even hold it together because this was the first time she was looking in the center. She wasn't twisted. I know. I took a picture with her. She's actually on the wall in the office. If you ever see it, it's kind of my why. And it's that specific adjustment. And, I don't mean to sound like what I did changed her life, but, now she's not stuck in this position and now she can be, she can develop normally and she can go through that. And if she hadn't gone and gotten adjusted or, learned, in my broken Spanish, trying to explain what was going on to her parents and how to help her. I mean, I really don't know what her life would have looked like. And so pediatrics has always played a big role. Obviously, I have a 7-month-old now, so I'm really like on it, making sure she's aligned. I mean, think they're learning how to crawl and then they're learning how to walk and pull themselves up. Think how many times they land on their butt. If we land on our butt, we slip and fall, our low back hurts, right? They just can't verbalize it to us. So getting them checked out by a pediatric chiropractor as they're going through their milestones is so important. And like we were talking about before, people kind of have that fear. They're like, oh my gosh, you're going to crack my 5-month-old. And I'm like, no, that's not what it looks like at all. They almost don't even know. The parents go, oh, did you do anything? I didn't even see you. It's so gentle. It's so specific. And the kids love it. I mean, they love it. We have kids that run through, they open the doors and they're like running to the tables and like, I'm first. And I'm like, wait, there's still a patient back here. Hold on. You got to stay in the front. So, that's just kind of the feel that we love in our office. It's just big families. That pediatric population, like I was saying, always pregnancy. I love the pregnant mamas. We have pillows that can make them comfortable. Their bodies are changing literally hour by hour as the baby is growing inside of them. So we want to make sure that their pelvis is aligned. They're able to push that baby out. Think of it. If you're trying to push it out of something that looks like this, that's not great. If we can make it nice and circular and pretty much a circle so the head can come out via aligning the pelvis, how much better is your labor going to be? I know it helped mine. So those 3 populations are really where I focus. Like you and I have chatted, we've had people sent, in their 60s with pelvic pain and still help them. So we do see everybody, but in my heart, those truly are my 3 favorite populations to work with. Yeah, exactly.
That's awesome. Well, this has been so lovely to chat with you. And as we wrap up, I would love, we have people listening in or people who have been patients at our practice or, might be connected to us via online and different things like that. Is there any one thing you would want to share with our population listening in?
Yeah, there's so many things, but the one thing that mainly comes to my head is, the chiropractic, like we said, has kind of this nuance around it. And I just want people to know, open your heart, find somebody that you fit with. That's a really big thing too. Not everybody's the same in all professions. So once you find that click, know that we have your best interest in heart. We want to get you better. And there's multiple ways to get there. We're a big drug-free profession. We want to help you with that pain management, but we also want you functioning to the best of your ability. Even if you don't have pain, we want to make sure we're setting you up for a lifetime of not having pain, so you never have to deal with it. So really, it's just find that one that you fit with, keep them close, put them as part of your tribe, and know that, you're always in our heart. We just love our patients. So whether it's us or you find someone closer to you, just find someone that you fit really well with, because we love you all.
Aw, awesome.
Yeah.
Awesome.
Yeah.
Well, thank you so much for your time today. I completely appreciate you. And we're really grateful to have you in East Cobb, so close to us as well. But thank you very, very much.
Yeah, thank you guys. We look forward to meeting some of you.
Yeah.
Yeah.